Dental services.
You know, Jimmy, on Friday, you asked me the question as host of the show, if there was one thing I would want people to know, what would it be?
Yes,
and I said that you're actually 5'3".
Yeah,
I was lying, I was joking. But you know what? I didn't get to ask you what you would want people to know about.
What I would want people to know?
Mm-hmm.
That I really need that motorcycle.
Well, anyway, that's the premise of a new series we're kicking off today, Now You Know. Returning to the many professionals on Delmarva and asking them what 10 nuggets of knowledge they really want people to know about their area of expertise.
So today, we start with your dentist. Dr. Lee Auchey is a dentist with Delmarva Dental Services. Thank you so much for joining us today.
Thank you for having me.
Thank you for giving us these most important things for us to know.
There's a lot of 10, so we got a lot of ground to cover.
Okay.
All right,
Let's do it.
jump right in here.
Rapid
First,
fire.
It is safe. It's safe for pregnant women to undergo dental treatment with local anesthetics. Is that right?
It is true, actually. So in the past, they used to recommend that you only do treatment during the second trimester.
Right.
They have now done some studies and compared patients who were treated with anesthetic or not undergone treatment, and there is really no difference in major medical outcomes based on the safety and the advances that we have in anesthetics today. So the thought really is that pregnant women have a lot of changes going on. Their gums can be inflamed. They can still break a tooth or have a cavity. So it's actually better to have needs treated than to avoid them for that whole duration of pregnancy.
All right, that's a good one to know. Next, it's not ideal to brush your denture or partial denture with the same toothpaste you use on your natural teeth.
Right. This question I find that patients are constantly unsure of, and when we tell them no, don't use that, they make products specifically for partials and dentures. They're surprised. So the toothpaste you use on your teeth is really quite abrasive, and it can wear down the plastics and the acrylics that are made, into the denture. So it's actually harmful to the denture.
Wow.
Didn't
Okay.
know that.
Yep.
So your third nugget of wisdom has to do with crowns.
Crowns,
Why do you
yes,
need
or
crowns?
caps, as
Or caps.
people call them. Yes. So basically something that is made of metal, porcelain, or a combination of porcelain and metal that looks like a tooth, feels like a tooth, but covers a tooth that has been treated with large fillings or a root canal, or may have potential for breaking in the future, or for cosmetics.
Okay, in your fourth tip, we're talking about tooth restoration, and you say just because a tooth is not right in the front of your mouth doesn't make it less important.
Absolutely. A lot of times we hear this, well, why should I bother fixing that tooth? It's in the back anyway, nobody will see it. I think it's a common misconception, again, that front teeth and back teeth do the same thing. Front teeth are good for biting into something or tearing something, but back teeth do the work. So the more back teeth you lose, if you just take one out here and there and it kind of begins to cascade, your front teeth are doing jobs that they're not meant for. And they end up breaking also, or having future problems too.
And cut it off while you get the chance. Okay. Next, dental radiographs, x-rays, right?
Sure.
X-rays.
X-rays.
Essential to the prevention and treatment of disease.
Absolutely.
Why?
So we look for many things when we look at x-rays, not just cavities. We're looking at your bone health and the levels of bone. We can assess the gum disease, and we can also look for other abnormalities like cysts, or sometimes even tumors, or even calcifications in arteries we can see on some different versions of x-rays.
What about the safety of radiation?
With the advent of the digital radiology, it's a huge improvement. So now it's actually so much less to get the dental radiographs, and you're doing it fairly infrequently, even compared to the normal radiation you receive just walking in an airport or staring at your computer screen for days. So.
I had no idea. I didn't know that. Okay, what about electric versus manual toothbrush?
I'll be honest with you. I switched to an electric toothbrush myself. I feel like I'm a really good brusher with a manual toothbrush, but there is no comparison to how much cleaner my mouth is using an electric toothbrush. It just gets to more surfaces, it vibrates and rotates a lot more, and your mouth really is cleaner. You get to a lot more than you thought.
Okay, next, the dreaded root canal. And you say most people are quite surprised when they learn the truth that root canal treatment is rarely painful.
Absolutely. People are coming in for root canals because they have pain. The root canal is not what's causing the pain. It's the solution to get out of pain. So in the past, too, a lot of times, the more infected or the longer the infection has been present, it may be harder to get numb, but now, again, with anesthetics, like I said, with the pregnancy, things have changed. There are so much more better options as far as getting you numb to make you comfortable for the procedure, that it is really not as big a deal as it used to be.
Wow. Okay, another thing that you say you need to know has to do with teeth whitening. Over-the-counter products that claim whitening are actually considered cosmetics and are not regulated by the Federal Drug Administration.
Right, so what those commercially bought products are made of is not the same as what we can offer you in the office. So anything technically like a whitening toothpaste, you're going to whiten your teeth just by the fact of brushing surface stain and plaque away. They're going to look brighter, whiter, shinier. But those products are not actually breaking down to create the process that causes real whitening of the tooth structure itself. So for those kind of needs, we offer trays that you can wear at home, sometimes offer in-office whitening or a combination of the two. And then of course there are some products over the counter like strips and gels that are slightly more effective, but again not necessarily whitening the same way that the in-office products could do.
Okay, now you want to address gum disease, and you say gum disease is a bacterial infection which is preventable and treatable in most cases.
Absolutely. So a lot of patients have plaque. Everybody has plaque. We all get it. It doesn't matter morning. It doesn't matter if you brush your teeth 2 times a day. But plaque continues to build up, and a lot of times it builds up in the pocket between the gum and your tooth. And the bacteria that form there are anaerobic, meaning they don't like oxygen, and so they stay there. If you don't constantly disrupt that by brushing, flossing, and routine dental cleanings, then that continues to have an additive effect, and it can actually cause the inflammation, bleeding, bad taste, bad breath, and the process continues to go on and on. So avoiding that and not doing your routine home care is not beneficial.
Not a good idea.
And there's a picture we want you to look at here. Address that. Tell us about that.
What are we looking at?
So the healthy gums on the upper left side, that is what we want to see. Nice, pink, healthy gum tissue curved around the teeth. Gingivitis is your next stage. That's on the upper right side. So that basically just means inflammation of the gums. That is treatable. It's reversible. That means you have just kind of started this process rolling. So you get a good cleaning, you update your home care, do your flossing, and that changes. And then we have the periodontal diseases where you actually start to have recession, bone loss around the teeth, more and more build up, and then you may need more extensive dental treatment to even correct those issues too.
Okay, so you need to know that we talked to Dr. Auchey before we started all this. She said there were so many things that she needs you to know. These are the top ones though. So the other one that you want to point out was about fluoride.
Right.
You said an optimal level of fluoride in community water is safe and effective in preventing tooth decay by at least 25% in both children and adults.
Yes. So we see all the time that people get decay. Unfortunately, our diets and what we eat, drink, and our home care, and sometimes even genetics, basically the bacteria we have in our mouths, we all have it, but it depends which ones and in what amounts. People get decay. So if we can help them have less decay, and we want to, and that's what fluoride does, is it actually absorbs into the tooth structure. So the combination of the acidic things that we eat and drink and the bacteria that's already in our mouth can't dissolve the tooth and cause as many cavities.
All right. Boy, that's a lot of information.
It is.
In a short amount of time.
Good.
You did great, Dr. Auchey. And now you know. And if you would like more information on Dr. Auchey's advice, just go to delmarvalife.com to read more about her 10 tips or to read more about Delmarva Dental Services. Thank you so much for coming in.
Thank you.